Imagine this. You're quite literally walking out the door for a crucial doctor's appointment. You reach into your wallet and your Illinois Medicaid card is just gone. Complete panic sets in, right? You're probably wondering, how am I going to get the care I need today? Well, take a deep breath because today we're going to solve exactly that. Welcome to this comprehensive explainer on navigating Illinois Medicaid, where we're focusing specifically on your ultimate guide to replacing a lost, stolen, or damaged card. Okay, let's dive right in by immediately de-escalating the stress here. If you've lost your card, seriously, do not panic. State policy actually explicitly notes that physical possession of that paper card doesn't even guarantee your eligibility anyway. So what does that mean for you? It means you can absolutely still get the medical care you need without having the physical piece of paper in your hand. Let me explain exactly why that's the case. The absolute crucial thing to know here is that what actually matters isn't the paper card itself. It's your RIN, or Recipient Identification Number. This is a 9-digit static identifier that's entirely unique to you, and it's permanently linked to your electronic state case record. Honestly, this number is the true key to your benefits because it allows your doctors to just look you up electronically in the state's registry in real time. So here's our agenda for today's explainer. We'll be covering 1. The Medicaid card basics. 2. A step-by-step replacement guide. 3. Common roadblocks and solutions. 4. Navigating managed care plans. 5. FAQs and additional resources. And finally, 6. A conclusion and official disclaimer. Let's start with Section 1, the Medicaid card basics, and understanding your foundational coverage. To really understand how to replace a card, we first need to look at how the state actually tracks your enrollment. The Illinois Department of Healthcare and Family Services, or HFS, uses a permanent single-issue paper card model. Now, historically, they used to actually mail out new cards every single month. But, to reduce physical infrastructure costs and make things way more efficient, they moved to this permanent model. This just means a new paper card is only generated automatically for very specific reasons, like when your application is initially approved, if you have a legal name change, or during your annual redetermination cycle. All right, Section 2, our step-by-step replacement guide. Let's talk about the absolute fastest ways to get your card back. So if you find yourself empty-handed, this digital-first method is hands down the most efficient way to replace your card. It completely bypasses mail delays and those dreaded call center hold times. Here's how you do it. Step 1. Log into the Application for Benefits Eligibility, the ABE portal, using the Manage My Case feature. Step 2. Right from your central dashboard, select View Notices. Step 3. Scroll through your communications until you find the PDF file representing your medical card. And Step 4. Simply print it out or save that PDF directly to your phone. Because healthcare providers do electronic lookups anyway, this printed or digital copy is a perfectly valid credential. But hey, if you're more of a phone person and you truly need a physical replacement mailed out, you can definitely use these official phone channels. You've got the DHS helpline for standard cases or the HFS hotline for general inquiries. But, and this is a big but, pay close attention to that bottom row. If your household includes a foster child or a ward of the state, those standard hotlines actually cannot process those requests. DCFS foster cases have a strictly segregated line at 1-800-228-6533, and that's just to maintain very strict safety and confidentiality standards. Moving on to Section 3, Common Roadblocks and Solutions. Let's troubleshoot some delays and mail issues. Let's tackle a massive pro tip right now to help you avoid the most common roadblock of all. You absolutely must update your address with the state before you request a replacement card. A huge roadblock people hit is assuming that just because they updated their address at their local doctor's office or with their health plan, that it automatically updates the state's central database. It absolutely does not. If you request a replacement without updating it, the state is just going to mail it to whatever old address they have on file. So use the ABE portal, the DHS helpline, or the change report line to update your info first. Now, what if your roadblock is that your initial application is just stuck in some massive administrative delay? Well, this timeline outlines federal mandate protections under what's called the Cohen versus Quirin consent decree. Basically, if the state takes longer than 45 days to process a standard application or 60 days for a disability case, this decree legally triggers your right to immediate temporary coverage. You can actually request a printable temporary medical card, also known as a T-card. This ensures you don't face a gap in care just because the state happens to be backlogged. Let's look at Section 4, Navigating Managed Care Plans. This is all about your passport versus your boarding pass. Honestly, this is a huge source of confusion for folks in Illinois. Think of it like flying. The paper HFS card is your Medicaid passport. It proves to the state that you're actively in the system and it holds your permanent RIN. But most Medicaid recipients in Illinois are also enrolled in a private managed care organization, or MCO. That plastic MCO card, that's your boarding pass. It identifies your specific health plan network, like Aetna or Blue Cross, and it lists your primary care provider. When you go in for care, you really should, ideally, present both. And here is exactly why understanding that difference is absolutely critical. The state of Illinois cannot replace your plastic MCO boarding pass card. Since those are managed by private insurers, if you lose that specific plastic card, you actually have to contact Aetna, Blue Cross, or Molina directly. The good news is each MCO has its own dedicated helpline and digital portal where you can order a replacement or just download a temporary digital copy right to your phone.
Okay, Section 5, FAQs and additional resources. Let's clear up some wait times and card confusion.
One of the most common questions we see is, if I call in, how long is it actually going to take for my card to arrive? The honest answer is approximately 7 to 10 business days. If you request a physical card over the phone or even in person at a local family community resource center, it has to be printed at a centralized state facility and then mailed out via the postal service. Honestly, that 7 to 10 day wait time is exactly why we highly recommend the digital ABE portal we talked about earlier. It's also incredibly easy for state programs to get mixed up. If you're missing a card, just make absolutely sure you know which one it is. The HFS medical card is specifically for your healthcare. Don't confuse it with the plastic Illinois Link card, which is managed by the Department of Human Services for SNAP, food assistance, and cash benefits. And on top of that, both of those are completely separate from the medical cannabis card, which is managed entirely differently by the Department of Public Health. Knowing exactly which card is missing dictates which agency you need to contact. Let's circle right back to our opening hook. Remember how I said you can still get care without your card? Well, here's how that works on the back end. Healthcare providers use a secure web portal called the Medical Electronic Data Interchange, or the MEDI system. To look up your active coverage electronically, they literally only need a valid photo ID and your 9-digit RIN. But check this out. Even if you don't know your RIN, it's really not a problem. They can just run a search using your photo ID, your social security number, and your date of birth. So again, a lost card literally never has to stop your medical care. Finally, Section 6, Conclusion and Official Disclaimer. Let's wrap up your replacement strategy. If you take one key takeaway from this explainer today, make it this. Going digital is the ultimate hack. Digital self-service via the ABE Manage My Case portal is undoubtedly the fastest, most reliable way to secure your Illinois Medicaid credentials. It bypasses the mail transit times, it skips the long call center holds, and it instantly restores your peace of mind. Now, as a quick professional disclaimer, please keep this in mind. Administrative protocols can and do shift over time. The information we've provided here is based on current state resources. You should always verify details and processes directly with official Illinois Department of Human Services or Healthcare and Family Services websites, just to ensure you have the most up-to-date, accurate information for your specific case. I want to leave you with this final provocative thought. Have you actually updated your address in the ABE portal this year? To protect your continuous access to healthcare tomorrow, do yourself a favor and take just 5 minutes to log in and ensure your contact information is perfectly up to date today. It is quite literally the single best way to prevent administrative headaches down the road. Thank you so much for joining me for this explainer, and stay empowered.